visualize. இன்னும் கொஞ்சம் பக்கத்துல அந்த கை காட்டுங்க. இந்த கை காட்டுங்க. What do you see? What law? இந்த கட்டவரல மேல நீட்டுங்க. கைகள் மேல ரெண்டு forearm பாத்தீங்களா? Can you compare the forearm? Wasting was present. எந்த சைடு wasting அதிகமா இருக்கு? என்னமா? What is the claw hand? What is the claw hand? Relax. Claw hand is nothing but flexion of the interphalangeal joint and extension of the metacarpophalangeal joint. So this is the claw. Okay. Point number 1 is there is a flexion of the interphalangeal joint. I am doing a flexion of the interphalangeal joint. This is not claw. There is an extension of metacarpophalangeal joint. If I attempt to extend my metacarpophalangeal joint and flex the interphalangeal joint, the resultant deformity called as claw. So this is the claw. So what is the major muscle that is acting on this particular muscle that straightens the interphalangeal joint and flexes the metacarpophalangeal joint? It's the lumbrical. So the action of the lumbrical is directly opposite to the claw hand. It can keep the interphalangeal joint straight, and it will be flexing the it will be keeping the interphalangeal joint in extension and flexion of the metacarpophalangeal joint. So this is what the lumbricals do. That's why it is called as a bye-bye muscle. So when you see Western series or Western drama, they will say bye like this. So this is called as a bye-bye muscle, where the fingers are kept in extension and the metacarpophalangeal joint is being flexed. This is straight. The opposite to it is flexion of the interphalangeal joint and extension of the metacarpophalangeal joint. So predominantly it involves the medial two fingers predominantly, and the deformity is worse in case of an ulnar nerve injury, which is happening at the lower level, which is a paradox. The paradox is the higher the level, the worse the nerve injury is. But for the ulnar nerve, the lower it is, the deformity is more prominent. That we call as ulnar paradox. So what is the difficulty here? It is the inability of flexion of the metacarpophalangeal joint and extension of the interphalangeal joint that is concerned with the lumbricals. What other small muscle you know in the hand? Intraosseous. For the lumbricals, there is two nerve supplies for both the halves. That's why we are having the claw hand that is present in the medial as prominent. What is the other muscle? Intraosseous. What is the supply of the intraosseous? Palmaris, pad, dab. Okay, that's fine. What is the nerve cell? Ulnar. So what will be his problem? You have seen the deformity, classical deformity that I have shown you. What you are going to elicit? What is the problem he will be having? There will be lack of adduction in the power. How will you test? Short test and the book test or Froman's sign. What is the Froman sign or book test? Yes, come. Get the book. Ada pura, ada book. For performing the book test, we have to keep the what are all the movements of the hand, what are all the movements of the thumb? Okay. What is flexion? What is extension? Flexion, extension. What is adduction? What is abduction? Abduction is perpendicular to the plane of the palm. That is abduction. So what is the problem here? It is adduction is the problem. What we are going to use? We are using a book to hold we are using a book to test the adductor. So The point number one is the palm should be facing perpendicular to the board or perpendicular to the book so that you can see what is happening. You can see, isn't it? My palm is here, my thumb is here, and both sides, volar aspect is visible. Okay, likewise, I hold with both the sides, hold similar. No, it should be like this. Okay. Now, as I try to pull, what power I'm using? I'm using the adductor. What power he should be using? Adductor. So the hand will not change. The movement will be similar. And we will try to have a tug of war with us. Okay. If suppose the person is having Allah now, probably in the left hand, what will happen is he lacks power of the adductor. But I have instructed him to hold the book. So he has to hold the book. What he will do? He'll use the flexor instead and hold the book. So what will happen to the thumb? Just watch the thumb. This is the plane of the thumb in an adduction. Gradually I rotate and flex the interphalangeal joint to hold. So on the right side, I'm doing it with a normal adductor. On the left side, I'm using a flexor. That means both my thumb on the right and left are almost perpendicular to each other. I'm just rotating my thumb, flexing my interphalangeal joint, the interphalangeal joint to hold it using the flexion. Okay, let's see what he does. இந்த கை பிடிங்க, நல்ல கை பிடிங்க. இந்த கையில இந்த புத்தகத்தை எப்படி பிடிக்கணும்? இப்படி 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 திருப்பாங்க வரல, இப்படி வச்சுக்கோங்க. அதே மாதிரி அந்த கையில even before I apply any pressure, in an attempt to hold the book itself, he is used, this is palmar and this is palmar that is facing you. And here, we have just turned the thumb downwards and he has flexed. I have not used any force at all. Can you see? This is called as what sign? Prom sign. You understand? The turning of the thumb, flexing of the joint, and using the flexor power to hold, he is just holding with that. This side is able to hold with a nicely placed thumb that is in adduction with the rest of the hand. Here, even for holding, he is using the flexor and the distal tip bed. This is the typical pronounced sign. So, number one, and the kaya cutting here, number one, there is a claw hand. Number one, there is a claw hand that you can see. There is a extension of the metacarpophalangeal joint and flexion of the interphalangeal joint. Okay. And second thing is, adductor has failed. Okay. And அந்த சின்ன இதை பிடிச்சிக்கணும், இந்த விரல் நடுவில் பிடிச்சிக்கணும், இப்படி வச்சுக்கணும், இந்த விரலை இருக்க பிடிங்க, அவ்வளவுதான். Now he is having enough power to hold at least a certain level of power. You will ask him to hold it. விட்டுருங்க, இந்த கை விட்டு, இந்த கையில் இதை பிடிங்க. இந்த கையில் இதை பிடிங்க. This is having reasonable adductor power. He is holding the card or a small paper between any of the two fingers. But on the other side, even keeping it in position itself is difficult. He cannot hold. This is another example of a card test. A card test is used to check all the introstums. Okay, fine. கை இப்படி வச்சுக்கீங்க. விரிங்க பார்ப்போம். இந்த கை காட்டுங்க. இந்த கை இப்படி சேர்த்து வைங்க. இப்படி சேர்த்து வைங்க. இந்த கை விரிங்க. ரைட். அந்த கை சேர்த்து வைங்க. விரிங்க. ரெண்டு கையும் இப்படி வச்சுக்கோங்க. இப்படி விரிங்க, இப்படி சேருங்க. விரிங்க, சேருங்க, சேருங்க, விரிங்க. Can you see? In the right side, அதுல கொஞ்சம் weakness இருந்தாலுமே he is able to fan his fingers. But on the left side, he is unable to do even the abduction. What is the abduction of the hand? In relation to middle finger, the digits are moving away or closer. So these two things are having a movement that is towards the midline, and these two fingers are having a different movement again towards the midline. So this is adduction, this is abduction. What is the movement that is possible for the middle finger? Both sides it can do an abduction because the center line is the midline. Both ways it can abduct it. Okay. So this is the basic of ulnar nerve injury. Other than all the higher areas we can function, we can check it later. This is the classical presentation of a hand in a ulnar deformity. Ulnar nerve. Okay. நீங்க அப்படியே கையை மடக்க. What is having? A total claw. All the fingers are clawed. All the fingers are clawed. Okay, is having a total claw. That means involves of what are the nerves that are involved? Both the compounds. Table chair போடுங்க. Table chair போடுங்க. மேல table போடுங்க. They never destroy.